Topic is post-COVID symptoms, or otherwise called long COVID. How important is monitoring and what are the tests to be done? Many patients who recover from COVID-19 and tested negative for virus later tested positive again. So many suffer from post-COVID complications and find it difficult to live the same old life after tested negative. Even though a person recovers from COVID-19, he or she still needs to be cautious for next few weeks, and hence instead of simply testing negative, post-recovery tests are recommended for such patients. It is observed that SARS-CoV-2 virus can leave long-lasting lingering side effects long after viral load has depleted. It can also affect the functioning of many vital organs and hamper immune response. It is crucial that post-COVID patients continue to monitor their health and avoid additional risk. We have been noticing that most of the patients who walk out of first-line treatment centers or who were at home quarantine for mild COVID infection do not even care to repeat a COVID test to see if they have become negative. Many of them follow home quarantine guidelines for 14 to 17 days and then start getting back to work or being actively involved in society without even testing themselves. This can be very dangerous to the patient himself and also to the society and persons he is directly in contact with. We must understand that our immune system fights rigorously to fight off the virus. It has been observed that SARS-CoV-2 virus can leave long-lasting lingering side effects after the viral load has depleted. So what are the common markers of the test that you need to do? There are several markers in your blood and immune system which can tell you to what extent your body is affected by the virus. These tests and scans are crucial to know how severe the infection was in the patient and whether it has left any long-standing complications in the body. The virus could impact vital organs including lungs in a profound manner. These tests will reveal how well recovered and healthy you are. So the commonest tests that we do are a complete blood count, blood sugar or a lipid level, and in some patients where they report of neurological, respiratory or psychological symptoms weeks and months after recovery, which can impact daily functioning. Symptoms like brain fog, anxiety, tremors, dizziness, fatigue, effort, breathlessness, etc. In such patients, a chest X-ray is always advisable, or a chest scan, CT scan is also a useful test that can be done. And some of the patients severe dyspnea while walking, chest pain, and also may exhibit symptoms of heart muscles, arrhythmias, and can lead to myocarditis, which is one of the most common post-COVID recovery problems reported. In such patients, an echocardiogram and a heart scan are very important. Now, some of the other few very important tests that should be done in the post-COVID patients are CRP, D-dimer, and also IgG antibody test. An IgG antibody test usually done to see will tell you how immune protected you are. The body produces helpful antibodies which prevent future infections. So checking these levels will tell you how well immune protected you are. The D-dimer is and CRP are another two very important tests beneficial for monitoring patients' progression to COVID-19 related cytokine storm and help in timely medical intervention to reduce fatality. So D-dimer is a protein fragment that uses itself soon after degradation of a blood clot. It is one of the most genuine biomarkers for both mortality and severity of any disease. It is a product of cross-linked fibrin which stays present in blood in case of blood clotting. This helps to easily assess the risks of pulmonary complications. So how is D-dimer test useful in a COVID-19 infection? In COVID-19 is a deadly virus which can form a colony in the lung and can turn very dangerous. Blood clotting within the lung is also being seen. So D-dimer appropriately shows the presence of blood clots in patient's body, even in lungs who are having severe forms of COVID-19. Now, what is long COVID? Long COVID is a condition where people continue to experience COVID symptoms long after they have recovered and tested negative. People suffering from long COVID either experience some permanent damage to lungs, heart, kidneys, or brain, or continue to experience lingering symptoms despite no detectable damage to these organs. So then what are the commonest long COVID symptoms? The commonest long COVID symptoms that we see are chest pain, difficulty in breathing, cough, unable to think clearly, what we call the brain fog, tiredness, extreme weakness, poor memory, anxiety, depression, post-traumatic stress, etc.